The initial concept of the centre grew out of a working group. There's YT, Peter, Ashish, Ken and myself. I remember Ashish standing out as a clear visionary in this particular area. He's really passionate, as was Ken, about having that sort of clinical research environment that was developed. And Quasar was the entity that actually allowed that to happen. And through that, we got good industry funding, again through Ashish and Ken's work with our different industry partners. That whole concept of putting it together, we created a map of what that looked like. And that was actually the backbone of the centre. The neural control of movement has always been central to my interests. I'm very passionate about understanding how the brain controls movement and especially how problems in sensory motor coordination have effects on people's health and well-being. Anything I can do to try and help people in that regard, I'll embrace with passion. And this is what Program 4 is about. So we've got a number of different foci within Program 4. One is about doing valid, objective assessments of assessment tools. So we've done a lot of work in that particular space so people can have a tool they can use in the clinic or in their home environment. The other one is understanding the connectivity, of course, between the brain and muscles too, and how this may be affected. And in Program 4, we're looking at how that is affected by pain. The third one is understanding the proprioceptive sensory information that's coming to the brain. So how does the brain actually sense what the muscles are doing? And that's another key focus of what we're looking at. Fourth one is examining the outcomes of reverse shoulder arthroplasty on functional movement too. So we've got a big population of people from Ashish and Ken who come through our area here for assessments. And finally, we want to develop new rehab programs. So while we understand everything, we want to translate that into real practice for individuals. And this is the focus of the University of Malaga's work, where they're developing the Move Us program. Program 4 has worked very closely with Zimmer Biomet, who's a key industry partner of ours, and we've worked with them in assessing and validating their MyMobility system of upper limb assessment using smartphones. And that's actually resulted in several publications and a good close working connection with Zimmer themselves. We're also developing a functional shoulder movement database that encompasses objective multi-level measures of joint and segmental motion. That includes kinematics and kinetics of motion, as well as the patterns of muscle activation that underpin movements. And this is for both healthy people and people who've had the reverse shoulder arthroplasty. So in addition to that, we're also developing IMU-based clinical assessment tools, which we hope will provide an essential multidimensional reference for design of implants, evolutions of new surgical procedures, shaping of post-surgical rehab, and evaluation of motion of treatment and success as well. Overall, the program will improve the understanding around the neurophysiological and biomechanical basis of upper limb movement, and this will allow for neuromechanically consistent and individualized rehabilitation. The one factor I think has really stood out is it's created a unique training environment embedded within a multidisciplinary approach to the development and implementation of technologies and practices that ensure a person or a patient-centered approach to treatment and rehabilitation. I think that's the key thing for the centre. Okay, I think we're at the dawn, or the impact of AI is really at the dawn of this use in our society and in medical practice. I mean, AI provides immense processing power and capabilities, but in my mind it should be utilised as support for clinicians in decision-making and practice. I think there will always be a need for expert clinical experience to ensure optimal, ethical, patient-centred care. For the future, I'd like to enable an individually empowered, person-centered approach to healthcare. Achieving this through AI-powered data analytical systems in conjunction with novel health sensing technologies. In fact, we've already started this with the establishment of a new centre to look at health sensing technologies in this particular context. So to me, that is the future.